Live from Arlington, Virginia, this is Transport Topics Newsmakers, the digital interview series that gives you access to candid conversations between industry experts and a veteran reporter. Sponsored by Tive. Here's your host, Dan Ronan.
Hello and welcome to Newsmakers from Transport Topics. I'm Dan Ronan. We have a great guest who will join us today to discuss a very important topic. We're very excited to spend the next 30 minutes or so with Dan Gagnon. Dan is the Vice President of Global Healthcare Strategy at UPS's World Headquarters in Atlanta. Like thousands of people at UPS, Dan joined the company right out of college in 1990, beginning as a driver, and he worked his way up through the ranks to where he is today. Before we begin our conversation with Dan, I want to tell you that Tive is the sponsor for Newsmakers. Let's watch this message from Tive, and we'll be back on the other side in just a moment.
Can Tive track which of your friends gets to the finish line first? Yes. But Tive is used by shippers and logistics companies to monitor on-time delivery of their loads and make sure that those loads arrive in good condition and in full. Tive.
Jump, jump. Jump more, jump higher. Jump, jump. Jump more, jump
Can
higher.
Tive be used to measure which of your friends generates the biggest shocks? Yes, but Tive is used by shippers and third-party logistics companies to monitor the integrity of their sensitive shipments in real time.
Wait a second. 92 Fahrenheit. 98 Fahrenheit. 97 Fahrenheit.
Can Tive be used to monitor your house temperature? Yes,
70 Fahrenheit room temperature.
but Tive is used by shippers and third-party logistics companies to monitor the temperature of their loads in real time.
First, a bit about Dan. Like thousands of people at UPS, Dan joined the company, as I said, right out of college from the University of Pittsburgh. He began his career as a manager of industrial engineering and eventually moved into new product development and evaluation before moving into the healthcare division, first in Europe as the European Region Healthcare Marketing Director, and now it's president for the division. Dan, welcome to Transport Topics Newsmakers.
Yeah, hey, thanks for having me, Dan. Really appreciate it.
Dan, from UPS's perspective, and I indeed know that this is somewhat of a narrow one, how's the rollout of the vaccine been going?
Well, I'll tell you what, in my 30 years at UPS, I'm not sure I've seen our company be driven as much as we have with purpose. So much so, we've actually changed our purpose statement, moving our world forward by delivering what matters. And I really can't think of a better time that we have as a company felt more aligned. The rollout has been good. It's been very good. When you look at it from a logistics perspective, UPS has really done extremely well. And what I mean by that is when we receive orders from our client, McKesson, our delivery is 99.9% effective at getting vaccines to points of care, hospitals, clinics, really where they need to be in order to be administered. So the distribution has really been going well.
Now, there's been a lot of concern and some criticism directed at the rollout of the vaccine, but it seems as though most of that has been when the product has already been delivered, that there's problems at the ground level, whether it's the coordination with the federal government and the states. But it seems as though, from what you're telling us, that the work that UPS and FedEx and others that are doing, that's gone pretty smoothly.
It has, and I'll tell you this, it's really all about planning. I will say that up front, there were significant challenges, specifically within the frozen supply chain that needed to be worked through. but the teams that came together, both public and private, really came together and worked on operating plans, and quite frankly, have been executing flawlessly as it pertains to the logistics.
Now, UPS is a worldwide company. We tend to think of them as some, American based in Atlanta, of course, but you're doing this on a global scale. And, we've got 340 million people in this country that have to be vaccinated, but we've got more than 7 billion people around the world that need to be vaccinated. So take that and multiply it by a scale of 20.
Yeah, so you're right. I mean, globally, you take a look, 7 billion people, as you noted, probably need at least 5 to 6 billion vaccinated for herd immunity. Who knows? With a 2-dose vaccination, you could be up to 10 billion doses. UPS's role has been pretty interesting. On the domestic side, certainly within the U.S., we've partnered with all kinds of parties. As we work with U.S. governments and agencies to distribute, there's been incredible collaboration. But there also has been, I'll say, some significant challenges. And this is not just within the U.S., but also domestically. I think a lot of these challenges have been solved for, but when you take a look at these challenges, I mean, first and foremost, it's the vaccine requirements, right? The temperature requirements. Today's vaccine market and supply chain is really built around a 2 to 8 C vaccine, 2 to 8 degrees Celsius. There's infrastructure, coolers, there is packaging that's clearly designed for that. When we take a look at some of the new innovation in vaccines that Pfizer and Moderna have, they've created DNA and mRNA vaccinations that literally require -20 Celsius to -80 Celsius, which is significant. The infrastructure was not there, coolers and packaging, and most importantly, tracking technology. So I think, there's been a lot of 3PLs and UPS specifically that has invested pretty early on in order to make sure that we're ready in order to distribute. Now, we really haven't been at this for long, right? I mean, literally, it was only 7 weeks ago that the FDA, had its first emergency use authorization for Pfizer. Now, when you take a look at it globally, it is going to shift. 2021 is going to be significantly different. We'll have a lot more volume moving through the system. We actually see some of these frozen vaccines being pre-ordered by organizations like Gavi, like UNICEF. So you're beginning to see the need for this same infrastructure in areas that really don't have it. When you think about serving Middle East or Africa or lower income countries. So, when we look at this globally, UPS ends up being a key piece of this. And I'll tell you just an interesting way how. We have a division, Markin, that actually worked on clinical trials early in 2020. So they managed a lot of the clinical trials for these vaccinations, which meant that we were learning about the products, the temperature requirements, the origins of manufacturer. So when we had to start building and designing solutions for these frozen vaccines, we were already ahead of the game. So we were solutioning this, quite frankly, in second quarter of 2020 for preparation. Now, as we shift and we look globally, the same thing is happening. Now, I don't want to shortchange it because globally we've already been delivering vaccines. I think at least as of yesterday, I think we've delivered almost 10 million vaccines across 21 different countries. So it's been significant for sure. Some of the challenges that we see out there globally, and I think this is going to be kind of a key piece to it, is there are a lot of remote areas and they are going to require infrastructure. We've designed in domestic remote areas, we have partnered with Sterling ULT, and they have mobile freezers that can be plugged into a car or a vehicle, have 220 and 110 voltage, and they can hold up to 7,000 doses. And we do think that's going to be a key piece of the solution for frozen vaccines as we move more abroad and try to help some of these lower and middle income countries.
The Johnson & Johnson vaccine is very close to being rolled out, and there's been a lot of optimism. It has a lower level of effectiveness, we are told, than the other two that are out there, the Pfizer and Moderna. but it can be transported at a much lower temperature. Is this going to be a game changer, even with the lower effectiveness, that it just makes it easier to get out there?
I think I'm not going to comment on whether it's going to the game changer complexity. It's really going to depend on which pre-orders they have and where they're going to be penetrating. I'll say this, the innovation that's been in vaccines to drive into these DNA and mRNA solutions, you can see by the media releases they are much, much more effective. And in doing so, you're going to see a higher take rate per shot. When you look at seasonal flu at best is maybe 56% effective, for your first shot. So I think there are going to be lots of manufacturers and providers that get their vaccines approved over the coming months. And I think there's going to be a place for each and every one of them. I'm going to go back to a comment I just made, sorry, Dan, in which some of the manufacturers that have created 2 to 8 vaccines, there is infrastructure there so that can flow pretty easily, or at least there is structure that it can follow in order to get to the administration sites. So there is a little bit of an advantage, at least in infrastructure.
Dan, we are about 11 months now into this pandemic. I always use the date of March 11th and 12th as sort of the starting point when it really took effect. That was the date that the NBA shut down their play in the season last year. And it also was the day, coincidentally, that Tom Hanks and his wife, Rita Wilson, it was announced that they were both sick in Australia while taping a movie about Elvis Presley, as an aside there. But at what point did UPS start to get involved in this and say, you know what, we're going to get a vaccine, and when we get the vaccine, we need to be ready? Was it March the 15th or was it June the 15th? When was it in the process when your company started to really gear up?
Yeah, so now an interesting question, because I think UPS is in over 220 countries. We're connected to ministries of health and governments. So it's not like we didn't see this coming. Our healthcare division specifically, we've got over 10 million square feet of healthcare compliant. Actually, strike that. We just added space. So we're at 11 million square feet of healthcare compliant space around the world. So we're connected. And I think when we saw what was happening back in December and January in China, we were pretty prepared. We were having conversations with our U.S. government. We were pretty vital in that first pass. We had a member of our organization sit on the White House task force and was part of, the original federal testing program, which then turned into state testing programs for COVID. We then got involved with FEMA, and we helped FEMA bring in millions of pounds of PPE into the U.S. as really the U.S. was just kind of taking hold. We're the national stockpile for FEMA, so we had a lot of the ventilators and protective equipment in our facility for preparation. Now, having said that, I'm going to go back because the clinical trials connection is really, really important. Our division that serves clinical trials is a company called Markin, and Markin is part of UPS Healthcare, and they really got engaged quickly. They ran a lot of the trials for a lot of the vaccines that are coming out today, and that really helped us. And that was back in February and March, where we really started to take a look at the landscape, started to look at pre-orders. Back in about April, somewhere around that time frame, you began to see ministries of health and governments pre-order vaccines from the manufacturers who had some vaccines in the pipeline. So we began to track that to understand where are vaccines being produced, where do they need to go by population, who is pre-ordering, and we'll get the first few. And that really helped us kind of build some sound strategies in order to help many of the countries around the world.
I know much of the work, because of the pandemic, has been done via Zoom and other type of video conferences and the like. But UPS is an Atlanta-based company. You're up on the north side of Atlanta. The CDC is over by Emory University, and that campus over there on the east side off of Briarcliff Road. Has the proximity to CDC been of any help at all?
No, great question. Well, I'm going to just divert a little bit here in that Even DEA has an office here that serves Southeast. We've got a lot of very, very strong healthcare customers, within the state of Georgia. UCB, it could really be a strong foothold. Atlanta and Georgia overall could be a strong foothold for the healthcare community. I just wanted to kind of throw that in because I think we absolutely see it. So yes, we've known the CDC for a very, very long time. They do. It's nice to have that connection because they will support us, and as we interact with our customers, it supports in messaging, and it doesn't necessarily give us any inside track, but it helps us frame up what we need to do, and if they need any help, we're certainly there for them.
Maybe some of the people are folks that you might run into at the grocery store that you're working with, or that someone who's in an administrative or a high-level position at CDC is someone your kids might have been in Boy Scouts or Girl Scouts with.
Yeah, you would be amazed at the community here. I mean, don't forget, you've got Emory, you've got a lot of great healthcare organizations. And quite frankly, I mean, I know everyone talks about Research Triangle and San Francisco and out west, but Atlanta absolutely could be that center for healthcare at some point in the near future.
Yeah, I lived and worked in Atlanta for more than 15 years, and it was really pretty amazing to watch the transformation from the late 80s when I got there to when I left to move to Dallas after 2000, that with the change and with just the healthcare, and that became such an enormous issue.
Yeah.
I've been out to Worldport in Kentucky a couple of occasions. What is a typical day like right now at Worldport with regards to moving the vaccine and out? What's going on there?
Great question. I mean, I'm going to broaden this too, because I guess just for the audience, Worldport is one of 4 regional sorts we have in the United States. But Worldport also is our campus, right? We say Worldport, but it's not just the airport itself in Louisville, but we have buildings, and we have, like I said, we mentioned 10 million square feet of buildings around the world. Louisville has quite a few buildings, and it has strong cold chain competencies. We've got 2 to 8 storage. I think most interesting, and probably what's hitting the media now, is we have freezer farms there. And these freezer farms, we have a freezer farm in Singapore, we have one in Roermond, Netherlands, and of course one in Louisville. They're becoming very popular, of course, with some of these new innovative vaccines. Now, these freezers, when you take a look at them, they are monitored, there are alerts set, there's high security, but they're able to maintain temperatures of -20 to -80 C. And it becomes a really important piece. So when you look at our healthcare campus overall, right, a lot of customers store their products or their vaccines, their biologics, even labs and kits get stored in Louisville. And because they are on airport property or pretty darn close to it, you can take an order on the other side of the country, and we can basically move that order over to our Worldport facility at 11:30 at night. It still gets on an airplane and gets to the West Coast or gets to Texas 8:30 in the morning the next day. So there's tremendous advantage for having buildings and facilities at the base of some of these all-point hubs and campuses. You can, as a customer, you can take orders much, much longer. You can also get the benefits of shared labor and shared best practices. It's another interesting thing too, I will say this, with campuses and locations like Worldport, healthcare is a really important segment, and we have a division that only focuses on healthcare. But the buildings next door might be high-tech, 3D printing facilities. We have all kinds of things in which we can share best practices and bring them into healthcare to make sure we're serving our customers and optimizing your supply chain the best we can.
There is, a new administration in Washington, D.C. and in the White House. Has UPS's plan or strategy changed because of the new team in the White House in the first of Mr. Biden and his group? Has this changed at all?
Yeah, no, it hasn't. No, it hasn't. And I'll say this, with what was formerly known as Operation Warp Speed, and I know they're changing the name, that team has been not only bipartisan, but absolutely focused on the task. I'm kind of glad you asked me this question, because the community, the folks who are on that task force, they're working 7 days a week. You have competition working with each other. You have public and private organizations. I don't know how many organizations on the government side, when you look at CDC, BARDA, HHS, all of these health organizations are working with each other. And the military. The military is running point, and I would say is extremely structured in what they're doing to get these vaccines to the states. So it has been business as usual. The whole process, logistically speaking, has been on plan and continues to execute regardless of the change right now.
Since you brought up the issue of cooperation, I wanted to bring this up because I think it's important. FedEx and UPS are usually viewed as rivals. I mean, you're both out there competing for business. You're both multinational, multi-billion-dollar corporations. But in this case, I would imagine to do this with the way it's being done, there is a lot of cooperation. There is a lot of collaboration. The country has been split in half, with FedEx taking the West. UPS is handling, by and large, the eastern half of the United States. How did this merge of cooperation, I don't want to say marriage of cooperation because it's not a marriage, but how did this all come about? How did everybody get from Memphis and Atlanta get on the same page?
Yeah, so I guess for clarity, we, for the U.S. domestic operation, and this is not for every pharmaceutical manufacturer, but as we talk about Operation Warp Speed, or formerly known as Operation Warp Speed, we work on behalf of McKesson, who is the contracted provider for Operation Warp Speed. There are also others, Walgreens and CVS, and I think all organizations realized that they needed to have access to options, and not only options for serving the country, but also backup. So, as those organizations, McKesson, CVS, and Walgreens, talked about their operating plans and how they wanted to leverage their transportation providers, they really figured out, how to kind of split it up in order to, it was less about share business. It was more important to make sure that the states and the point of care that we were delivering to were the right ones for our network, right? That was one. And then two, redundancies. Right? When you look at our campus in Louisville and FedEx's campus in Memphis, we are each prepared in case there is capacity issues to help the other out from an operating procedure or redundancy procedure. So, it's been exciting. Both Richard Smith and Wes Wheeler have participated in vaccine summits in Washington, D.C. So UPS and FedEx are right beside each other. When we're having the conversations of what we need to do to get these vaccines in the right hands. So it's been good, a great experience. I don't know if you've seen social, but even we've had FedEx and UPS drivers. We've captured a lot of images where the two of them are together on social, perhaps right in front of a hospital dock, which I think is fantastic.
It's pretty cool from a marketing standpoint too, isn't it?
Yeah, it is. It is. It's a lot of fun.
Good. The new president, Mr. Biden, has called for the use of the Defense Production Act, as it's called, to help with rolling out the vaccine. Will that help? Will that get more vaccinations? I mean, we've talked about this goal of 100 million vaccinations in 100 days. That's probably doable from everything that we're hearing. But if the Defense Production Act is invoked and that gets the military involved to a greater degree, will that ratchet it up 1.2, 1.5 million vaccinations a day?
Yeah, so I can speak to, when you talk about 100 million vaccinations in 100 days, I mean, from a logistics perspective, that is absolutely doable. I think what has been put in place domestically, and this is what everyone's been working on, quite frankly, since mid-December up until now, are operating plans that get both negative 20C and negative 80C vaccines and 2 to 8 vaccines to the right locations. Logistically, that is not going to be an issue whatsoever. As you commented earlier in the discussion, the work that needs to be done intrastate to make sure that vaccines are getting into arms is certainly going to be a key focus. But again, I don't see any issue with that goal. I think the bipartisan group that's been working this is they're ready.
You know, many economists that I've talked to said that we won't have an economy that is fully recovered or back to some degree of normal until we get a vaccination rollout successful. In terms of the calendar, we're looking at July, August, September, sometime along that line. Is that a goal that you think, based on what you just said, that's reachable, that we can get to that goal and we can be there late summer, early fall?
Yeah, so I guess it depends on what your definition of normal is.
Yeah, that's a good point.
I don't know if we ever completely go back to the way things were. I do think that there have been some best practices and things that, quite frankly, have been for the better that have come out of this on how we work, perhaps even the flexibility of where we work. So I'm not sure. We'll have to see how that pans out. I will say this, if you look at UPS overall, business has dramatically shifted, right? And maybe temporarily from retail in stores to online, and maybe there becomes another balance. But we are absolutely seeing economies around the world come back. I'll stick to healthcare for a second, where, during last year, a lot of medical procedures, dental, audiology, there were sectors that people were just not leveraging anymore. They were in their homes. They weren't going through and scheduling elective procedures. And we're seeing all of that come back. And, we actually are seeing it come back here in the first quarter. And we do think that it's just going to continue, to drive forward. Will it be back to where it was in 2019? We're not sure. We're not sure. But I will tell you this, that we're seeing positive bounce back now.
As a healthcare professional, what's really amazed me about this is the history. When you look back at the history of vaccines, it took years to get an effective polio vaccine. A lot of trial and error, a lot of mistakes, a lot of roads that looked promising that didn't work out. We've managed to, as a medical community and as a pharmaceutical community, create a vaccine from scratch in less than 6 months. Does this give us a roadmap for creating other vaccines for other dangerous and sometimes deadly illnesses that we can conquer and maybe improve the quality of life for people? Does what we've learned now over the last year make life better for folks who, may get an illness 5, 8, 10 years down the road from now?
Yeah, no, a great question. And I think you've got some insight to this, because I do think clinical trials have changed and changed for the better. I was reading some statistics, and we're looking even, 4 to 11 years was kind of the average for bringing a vaccine to market. Structurally, clinical trials are changing, in which they're doing mega trials, more patients. They're collecting a lot more data in a lot faster pace, which of course is good. It's good because what they're doing is condensing some of that analytical work. It doesn't mean that they're shortchanging the analytical work, and I think that's an important piece. These vaccines, as they are actually, being approved for emergency use, have every bit as much of data as some of the vaccines in the past. So we will see. I do think that we are going to see a sustained difference with clinical trials for sure. Key piece of trials, as you may know, is it's testing not just on a single population, but different segments, different demographic segments, whether it's age, ethnicity. So those are the kinds of pieces that tend to lengthen a clinical trial. And again, I think you're going to see a consolidation on that for sure.
You've been with UPS now, as I said at our intro, since you came out of college and you got your master's degree. I'm sure you've had a lot of really interesting things that you've done at UPS, both domestically and Europe. But has this been the most interesting thing that you've done in your career, and will sort of be, when you finish your career at UPS, 10, 15 years down the road, 20 years down the road, you'll look back and say, this is my marker. This is the one thing that I'm most proud of?
Yeah, I think, and that's for all of us here at UPS Healthcare. I mean, we've been focused on healthcare for about 18 years, but this was the first year, well, 2020 was the year we stood up the healthcare division. We created a separate brand. We actually brought all the folks dedicated under one umbrella. And most of the people who are here at UPS Healthcare, they are healthcare professionals. They are in it because they love healthcare. And they love healthcare, but do logistics to support it. And I make that nuance because if you're that kind of person where you just love the sector, you love what it does, you can feel the impact on people, you absolutely see this as the most important thing you've done in your work life. And I do. I've had lots of opportunity. I've been in healthcare for almost 17 years now, in Europe, here in the States. And I do think that what's happening right now, it's a significant impact. It will continue to be a significant impact. And I think our group is just absolutely motivated to be a part of the solution. And I can see that. I see that in our workforce. By the way, not just even UPS Healthcare, but our drivers, our pilots, when they know that they're carrying a box of vaccines, there's some excitement. You get a selfie, I'm part of the solution, and I think it's fantastic.
I should tell you, Dan, that I've got a son and a daughter-in-law who are both in their now mid-20s who work in healthcare. They're both frontline ICU nurses in Dallas and working, with COVID patients. And both of them express that same passion that you do, that this is the most important thing that they'll ever do, because of just the fact that it's life-changing. And they're starting it, they're 2 years out of college.
Yeah, no, and you can sense that. And when they come home, what I really enjoy too is, you watch the news, and I think if you are on the front lines, if you are administering the vaccine, if you were part of Operation Warp Speed in the supply chain, you're hearing the news played back to you, but we were there. Right? We're in there. We're eyeball deep. We know the operating plan. We know the nuances of what's being reported versus what's really happening on these calls and out in the field and delivery. So it's been very interesting.
You sound pretty optimistic about this, and that going forward, that we will, at some point in the not too distant future, 6 months, 8 months, we'll get to a point where we can go to a ball game, we can go out to dinner, we can do all those things that we did before and not have to fear that, a couple, 3-4 days later, we're going to lose our sense of taste, and then hope that we don't get a cough, and then who knows what else.
Yeah, I really am. And I know right now the news with, climbing cases, it tends to kind of come out loudly, across many of our news channels and streams. But I tell you what, I am optimistic, and there's a couple reasons, and it's less about what's going to happen in the next 2 quarters, right? We will get the vaccine out. It will get into arms. People, will be protected. But when I look at the changes that will be in healthcare logistics afterwards, I get really excited. This investment that's going into cold chain and, whether it's, again, coolers or freezers or packaging or tracking technology. And one of the things I didn't mention is, this actually pushed us to invest in new tracking technology where we can actually find a package within 3 meters. I kid you not. This packaging technology literally looks like duct tape on the side of a package. It has very sophisticated technology in it. User can actually use their phone, and it works almost like a Geiger counter. As someone walks towards a package, it literally will tell them closer, closer, closer. But again, it's the investment that we've made and UPS has made. We're not the only ones who have invested in freezer farms, right, or tracking technology. And I want to say that as a healthcare professional, when I look at after what happens here, we're going to have much better cold chains all over the world, even in Africa. So when you look at vaccinations and you look at some of these, biopharmaceuticals and products that need to actually get through to a patient, we're going to have more compliant, faster, flexible, just better cold supply chains to make sure that, those medications are there, get there safely. I don't know if the audience knows, but when you take a look at the drug pipeline, 55% of the drug pipeline is going to require some sort of cold chain. It's massive. That means that most of the solutions that are in the drug pipeline to solve cancer, respiratory illness, cardiac disease, all those big chronic diseases that, a lot of us are getting nowadays and will have for the rest of our lives, Healthcare pharmaceutical industry is prepared, and they're going to need these cold chains. And COVID has forced a lot of companies to invest, and I think that's why I'm optimistic.
Unintended benefits, clearly that's what it's turning out to be, because of a horrible illness that by the time it's all over may have killed 500,000 people in this country and well over a million or so worldwide. But we get something out of it, and may their memory of the people who died be a blessing. But certainly we thank those that have created all of these great techniques and these great technology to make it work.
Yep, you're absolutely right.
Dan, thank you. It's been an informative conversation, and one that I've really enjoyed, and I hope that our viewers have enjoyed as well. Dan Gagnon from UPS joining us on the Newsmaker line. Dan, thank you.
Thank you. Appreciate it, Dan, and thank you for the time.
In closing, we want to thank our sponsor, Tide, for making this Transport Topics Newsmaker webcast possible. We also thank Dan Gagnon at UPS for being so generous with his time to answer our questions. This webcast will be available for viewing on demand, so go to ttnews.com for more information, and again, how you can watch our interview with Dan. I'm Dan Ronan from Transport Topics. Thanks for watching.
Thank you for joining us today. For more information on future episodes, visit ttnews.com. This has been Transport Topics Newsmakers.